fibular anatomy here. And again, we know that the fibula is lateral, the tibia is medial. Think of the lower leg, because it's a long bone, is going to be similar in how you scan the femur. The femur is considered a long bone. Tib fibs are considered long bones, okay? When we're scanning the knee, we have a dedicated knee coil. When we scan the tib fib, we're going to use the torso PA coil, just like we did the femur. We're just going to put the lower leg bones in the middle of it, right? So setup is really not difficult when we're doing these scanning of tib fibs, okay? So we'll go through the anatomy here, then we'll kind of take a break before we look at how do we set up for knee and tib fib. Other than you have your tibia bone, and we have your fibular bone. And in MRI, if we're looking for MRI and specifically of the bones, we're looking for maybe a stress fracture in the bone. Runners, marathon runners, long distance runners have stress fractures. Stress fractures doesn't always show up on an x-ray right away. They're still having pain. Well, maybe there's actually a stress fracture in that fibular bone or the tibia bone. Other than that, many times or most of the times when we do a tib fib, it's going to be for a mass. They have a lump, they have a tumor somewhere in that tib fib area, or we're looking for a muscle tear. Okay, again, maybe runners, somebody jumped off of the back of a pickup truck, I've had that, and they actually tore their gastroc muscle. Okay, things like that is why maybe you would do tib fibs. You don't see tib fibs a lot, but you will at some point in your career, okay? I know in clinical, I think the tib fib clearance is an elective because some places, you know, you're not gonna see it very often, okay? So for the lower leg, and they call like tib fibs lower leg, it's more of a muscle issue or a bone issue type of a thing. The gastrocnemius muscle, we kind of shorten it and we say gastroc, but that is your calf muscle. We can all reach to the back of our leg and we know where our calf muscle's at, right? That is your gastrocnemius muscle. It's the muscle on that outer edge of your calf. If you peel away the gastroc muscle, then you get into the soleus muscle that is more internal to the lower leg. The gastroc muscle here attaches to your Achilles tendon. Well, we all heard of our Achilles tendon. We know where that's at, right?
Okay. Is the gastroc on both of those pieces in the back?
Yes, yep. You have peroneus longus muscles and peroneus brevis muscles. This is in the front of your lower leg. In the back of your lower leg, you think of gastrocnemius, then the soleus muscles, okay? Another thing to think about or to remember is the muscles that are in the anterior part of the lower leg are your extensors. These muscles in the back part of your lower leg are more of your flexors, okay? Your gastroc muscle in this particular image, this is the gastrocnemius muscle is the most torn muscle of the lower leg. So look at extensor, right? All of these are in the anterior aspect. If we peel away the gastroc muscle, we have a soleus muscle, a plantaris muscle. Deeper into this calf, we have these flexor muscles, right? So what I just want you to understand is if I say I'm looking at an extensor digitorum muscle, is that anterior or posterior? It's anterior. If I'm looking more at these flexor brevis muscles, is that anterior or posterior? More posterior, right? If I'm looking at the soleus muscle, is it anterior or posterior? Posterior. Gastrocnemius, anterior, posterior. Right, that's what I want you to understand is when I'm looking at these muscles. The Achilles tendon, where's the Achilles tendon at? Posterior, right. Another word for Achilles tendon is the calcaneal tendon, because this tendon attaches to the calcaneal bone of the foot, or we call the heel bone, okay? So if I'm talking about a calcaneal tendon, and I ask you what's another word for it, you know that it's the Achilles tendon, okay? So just kind of like make sure you understand the muscles, kind of like with the femur. You know, what makes up the hamstring muscles? What makes up the quad muscles? In the lower leg, it's just kind of like that too. It's more muscular type of information.
When you say extensors and flexors, are you thinking about like the knee or the foot? Because when you extend your
Kind of almost think about like if you would be on your tippy toes and you go down and you can almost feel those muscles, your gastroc muscles, and then you push them up, right? Extensors go down, flexors like that, okay? But in particular, like, you know, when you say flexors or extenders, we're thinking the foot joint and the knee joint are kind of, right, where they work together, okay? But for the muscles that allow the knee to extend and the foot to flex are these muscles in that lower leg, okay?
So when you flex your foot, you're using the muscles on the back of your leg?
Right, and I can almost feel it. When I really try to flex my foot forward, I can feel my gastroc muscle, right? And then when you release it and you extend the foot, then you're pulling those muscles back together. That muscles are shortening or elongating, right? Okay. This is just a picture here of this lower leg again of this tibial tuberosity. It's where this patellar tendon inserts. You know, technically this all area is considered the lower leg. Again, it's similar to the femur. You might not be able to get the knee joint and the ankle joint in that dorsal coil. So where is the pain at? Is it distal? Is it proximal? If you're looking at the gastroc muscle, because that is going to be more of that upper calf, I'm going to make sure I get that knee joint on. And as much of that lower leg as you can, right? So think about, you know, when you're doing your practical, and if Kelsey or whoever your patient is, where is the pain in your lower leg? Where is the lump? You know, sometimes patients will come to, you know, me and they'll say, I feel something right here. And you can almost feel like it's a knot. We can put an oil marker over that area, and we just make sure that we get as much of that lower leg, and wherever it's closest to one particular joint, I get that joint included, okay? But you don't want that oil marker in the center per se, because I really want to get as much of that muscle and tendon as I can. Okay, does that all make sense? Notice here, this is a new word. I don't know if you can read it up on the screen, but it's called retinaculum. We have retinaculums throughout our bodies. We're going to talk about it in particular with our wrist joint, because what that is, and it's a very thicker fibrous ring that goes around our ankle, and we'll talk about it more when we do an MRI of the ankle, but it holds these tendons in place. So they almost kind of look like they're wraps around our structure, right, our anatomy. We also have retinaculums in our wrist as well. So it's kind of like a hard fibrous cartilage that holds these things in place. So it goes around, it almost looks like a bracelet per se, okay? Blood supply, well, we've talked about the popliteal artery. Then it branches into other smaller arteries. We have an anterior tibial artery. Well, that makes sense, it's gonna run in the anterior tibial aspect. The fibular artery, okay, well, here's the fibular bone, it's gonna run here. And then behind the tibia here, you have a